For the first time in a decade, there are new guidelines to lower the risk of heart attacks and strokes. Two leading heart organizations issued the recommendations, which could lead to a big change in the number of Americans who use statin drugs to lower cholesterol. Dr. Holly Phillips is with us. Good morning.
Good morning, Charlie.
So what are these new cholesterol recommendations?
Well, they really represent a paradigm shift in how we think about statins. Whereas the old recommendations focused almost specifically on target LDL numbers, the new recommendations are asking doctors to step away from the numbers and think about cholesterol really with four big questions. Number one, have you had heart disease or a stroke before? Number two, is your LDL over 190? Number three, do you have diabetes and over the age of 40? And number four, is your 10-year risk of having a heart attack greater than 7.5%? If the answer to any of those questions is yes, then based on the new guidelines, you should be on a statin.
So why are people saying that these guidelines may mean that twice as many Americans should consider taking these statins? And what are the side effects?
Right. Well, that's really kind of what's making the guidelines controversial. It will include a greater number of people in the statin pool. However, statins do have side effects. Some of the most common are joint pains, muscle pains, liver problems. So there are really two schools of thought. There are doctors who think everyone should be on a statin, it should be in the water. There are other doctors who are much more skeptical of it. So putting double the number of patients in the pool is creating some controversy.
All right, thank you.
Thank you, Dr. Holly Phillips.